If you're a male who's constantly tired, losing muscle, and just not feeling like yourself, testosterone could be at the root. Here's what you need to know about testosterone, testosterone replacement, and how to get your body back. I feel like, honestly, men's health gets so neglected. So many men I meet in practice are struggling with low testosterone, not feeling like themselves, tired, foggy, gaining weight, and really at a loss as to what to do. Here's what's happening out there, and I know you guys have seen this and kind of are watching the same things that I am. It seems like there are a million different companies, ads targeting men for hormone replacement therapy, right? Not feeling great, get a testosterone shot. It's the answer. It's the miracle in a bottle, kind of the equivalent of the elixir of youth that we women sometimes chase as well. Well, in this next video, we are going to talk about testosterone and something that is incredibly connected to testosterone that nobody is talking about, and that's cortisol or stress. So many men today are coming in with low testosterone, and this, by the way, is not just for men over 40 or over 50. Everyone thinks that we are just having a conversation about them. We are seeing low testosterone in our boys. We are seeing it in young men in their 20s and also in their 30s as well. So let's break it down. What's happening? First of all, testosterone, remember, is the dominant male hormone responsible for many different functions in the body. And guys, it's not just about muscle mass and your libido and all of the stuff that goes with that, all right? Testosterone actually impacts your bones, impacts your brain, plays a role in your overall metabolic health, and blood sugar management, will impact your heart health as well. And so it's not just a two-job hormone. It actually is a hormone, like many hormones, that impacts the entire body. But when we think about testosterone today, many men are like, well, how do I know if I'm having an issue with testosterone? Well, of course, you can get your testosterone levels checked, but if you are not yet at the point of walking into a doctor's office or a lab and trying to understand what that level is, here are a few signs and symptoms that you may be struggling with low testosterone. If you are now gaining weight and you don't understand why, you could have low testosterone. If you are tired a lot throughout the day and you're still getting consistent sleep, you haven't really had a big change in your lifestyle, that's another sign of low testosterone. If you've been hitting the gym and doing your workouts and you are either having workout fatigue, meaning the same workout you simply can't get through, you end up feeling exhausted afterwards, or you're in your workout and nothing's changing. You're not building muscle, you're not losing weight, another sign of low testosterone. And yes, in the bedroom, that's a very obvious place for finding low testosterone, where either your libido's down, you can't hold an erection, or you really just have no desire. So low testosterone can show up in many different ways. But what I'm looking for, and what many people are looking for in the exam room, is when do we act and what do we do? If you are checking your testosterone levels, an ideal testosterone range, according to traditional literature, is somewhere between 300 and all the way up to 1100. Now, for those of you who have already jumped into the world of testosterone replacement therapy, you tell me over and over again that you want your levels to be close to 1000. And we're going to talk in a second about why that may not be the safest situation. Now, one of the things that we see over and over again is that this conversation around testosterone seems to limit itself to testosterone. But there's another hormone at play that we need to take seriously, and that's cortisol. No matter how much testosterone you're taking, if your cortisol levels are not balanced, that testosterone is not going to work for you. The traditional Western medicine approach, the conventional medicine approach to testosterone replacement therapy or to low testosterone, is to give you a shot of testosterone. Most men are getting testosterone in a dose of around 100 milligrams or 200 milligrams that they are supposed to do weekly to boost up those testosterone levels. Now, some men actually do testosterone gels depending on their medical conditions and what else is happening around their health. One of the places that's sort of up for debate when it comes to Western medicine is, do we or do we not give testosterone to men who have had a cardiovascular issue, a clotting disorder? Because there are some studies to suggest that those higher doses and higher levels of testosterone replacement may play a role in clotting dysfunction and worsen cardiovascular disease. There are other studies that negate it. I feel bad for you guys. I feel like you're in the same place that women were with the whole debate on hormone replacement therapy and the Women's Health Initiative. The other part of testosterone replacement that is done traditionally is to prevent the aromatization of testosterone. What is that? What does that mean? That means that testosterone can convert to estrogen. Estrogen is the female hormone, and in turn will make you again gain weight, have breast tenderness, and many of the other symptoms that we women experience with estrogen not being metabolized correctly. So going back to the Western model, you check your testosterone level historically, you get a testosterone shot or gel, and you usually get an aromatase inhibitor, another pharmaceutical, to go with it. There are many different, Arimidex is one that many men use over and over again to prevent this aromatization. And that kind of ends the Western medical conversation around testosterone. But when we start to flip gears here and we think holistically, or we think through the lens of Eastern medicine or functional medicine, the conversation completely changes. Now we start to try to understand why. Why do you have low testosterone? And especially if you're a young man in your 20s, we want to get your head around this idea because this is becoming an epidemic. And I'm honestly worried for all of you. I have my own son. This is a conversation that I want to have with him when the time is right. So again, whether you're in your 20s, 30s, 40s, 50s, 60s, we've got to get this right. Eastern systems of medicine define low testosterone in many different ways. In Chinese medicine, it was low kidney energy. The kidney meridian was off. If you're going to an acupuncturist, they may tell you that. They may also have said that your low testosterone was due, or your symptomology was due to liver meridian dysfunction. You're just not metabolizing things, right? Or there was a third type, the type that had spleen dysfunction or gut issues. For men, low testosterone was a predicted side effect of excessive pitta or kapha energy, those doshas. Pitta is those fireballs. They're like pummeling through life, doing whatever they want to do, but not taking time to bring cortisol down. Whereas the kaphas are struggling with gut dysfunction and weight, and eventually testosterone starts to go down. So again, Eastern medicine personalized a testosterone replacement plan. Functional medicine also does that, but looks a little bit deeper. It starts to talk about things like cortisol and the impact of cortisol on testosterone production. High cortisol or chronic stress in men will deplete or decrease testosterone levels. We've seen it. The physiology is there. The studies are there. So for all the men who are powering through, right, it's the phrase I like to use over and over again, we know that they eventually will start to have lower testosterone levels simply because of stress. But that cortisol is also being overproduced for a couple of other reasons, and this is where functional medicine comes in and really starts to dive into some of this stuff. Another reason is simply the gut and the microbiome of the gut is not optimal for healthy testosterone function. Either there is fat malabsorption that we've actually talked about with women's hormones as well, where men are losing fat and they can't build testosterone effectively because you need that to build hormone. Or they're on pharmaceutical medications that are causing microbial dysfunction or fat malabsorption, leading to low testosterone. Guess what a classic medication is that is dropping testosterone levels drastically in men? I don't know if you know, but statins. Statins will lower testosterone level. Blood pressure medications lower testosterone levels, and antidepressants and anti-anxiety medicines lower testosterone as well. And so many of you guys are on a concoction, a cocktail of these medications. Okay, but let's not blame all the medications. Functional medicine talks about something else as well. It talks about diet and the impact of diet on hormone production in men. When you are eating a processed, highly processed fast food diet with a lot of alcohol, alcohol is a singular variable of disrupting and lowering testosterone production. By itself, it can drop your testosterone levels. So for all of you guys getting more than 4 drinks a week, you're at risk for low testosterone. We also know, again, not getting enough protein can play an impact. Not getting foods high in zinc or fiber, plays an impact on your testosterone production too. All right, we got to talk about one more variable because this is one that really has me up at night as a mother of a son, as a wife, and having so many amazing men around me. And that's the load of our environmental chemicals. We know over and over again, I have seen it in practice because we are able to do the testing, how heavy metals are connected to low testosterone, how BPA and phthalates drop testosterone levels as well, and how so many other forever chemicals are changing testosterone levels in our young boys and our teenagers. So this is an issue that functional medicine and integrative medicine highlights, but Western medicine doesn't touch. All right, let's do testosterone the whole plus way, all right? Let's think about it holistically and build a plan that's gonna work not just for a lab value and a singular number, but for a plan that's really going to work for longevity, for optimization, no matter how old you are, and can keep that pharmaceutical list shorter and shorter and lower. We're going to break it down very simply. Your starting point is to look at your diet and the things that you can change. And here's what you can change. Bring alcohol down to under about 4 drinks a week. Have a good night out with the guys, but not every night, right? Find some alternatives that you can hopefully use and maybe influence the others in your group to do the same because it's impacting you guys drastically. I think secondly, start to minimize the load of processed and packaged foods. Choose whole and clean foods when you can, and really up fiber, plant foods, nuts and seeds that will give you the zinc you need to boost your testosterone production. We also know that protein is incredibly important. So if you are vegan or vegetarian, you do need to add in additional protein to help you with testosterone. In fact, arginine, for example, is something that we see over and over again. That's an amino acid, and a lack of arginine will drop testosterone. All right, next, let's move on to understanding the gut, using things like digestive enzymes, making sure your food is getting processed, making sure you're going to the bathroom every day. These are fundamentals of good gut health that help the liver, that help testosterone. It's all connected. Next, we want to look at your stress and your cortisol levels. If you are not sleeping consistently, at least 4 nights a week, you are at risk for lower testosterone levels. So look at your sleep routine. Engage in cortisol lowering activities, whether it's a weekly massage, getting out in nature, playing golf even, all of that is great in terms of bringing cortisol levels down. After cortisol management and really thinking through stress, also really try to pay attention to your chemical load. And we have quizzes and assessments on the Whole Plus website to help you kind of get your head around that, sink your teeth into that, to understand what your greatest risk is for too many chemicals that in turn impact cortisol production. I think it's something really important to pay attention to. And that's where alcohol, by the way, connects back up. Because if you're burdening the liver can no longer handle this environmental load that is now a reality for all of us. All right, after that, there are supplements that do indirectly help boost testosterone. I like adding about 15 milligrams of zinc. I've seen that work in practice over and over again. I like adding an amino acid blend with some arginine and even some glutamine in it that helps to boost testosterone levels too. Both of these are critical, a good probiotic, digestive enzymes, and then if you need something to support sleep and cortisol, the world of adaptogens is something that you should be understanding and digging into. And I talk a lot about many adaptogens in this video right here. So ashwagandha, holy basil, reishi, these are things that help manage the stress component of this conversation and can make a difference in your testosterone levels. And when it comes to levels, if you're not at least somewhere between 400 and 600, you're not you, and you're not feeling the best you that you can be. So a natural approach oftentimes gets you there, and that's a starting point, especially if you're a man under 40 or so. This is where I would start with diet and gut work and cortisol management and supplements. If that's not budging or changing things, now you're ready for testosterone replacement. And when we do testosterone the Whole Plus way, here's what we do. We don't do the mega shots of 100 or 200 milligrams. We're titrating. We'll try 10 milligrams, 20 milligrams, maybe even 30 or 40 milligrams, because those lower doses get you to where you need to be without having to worry about some of these side effects like clotting disorders and the like. So again, it's this very gentle balance between using what we know in Western medicine or what we have available, using the technology of labs and science, but pairing it with the philosophy of Eastern medicine that thinks about the liver person who needs to detox, the gut person who needs a better diet, or even thinking about the kidney meridian person who just needs more nutrients, more support overall. And this approach, the Whole Plus Way, is what works, and what works for the long term, and is sustainable for your health, and not just the two factors that you guys worry about, muscle mass and bedroom performance, but also for your cognition, your bone health, your heart health, your weight, your metabolic health, and so much more. You can tell I'm pretty passionate about this because I'm really, really worried. So if you have not thought through a holistic approach to testosterone replacement, I'm urging you to do so. And I know that you're going to feel better, look better, and do better for the long run. All right, I post new videos every week. Don't forget to like and subscribe. And if you're ready to try to understand your toxic load, check out our website, wholeplus.co, or if you want to be a patient, click the link below.